Exercise as medicine. Now, some doctors hoping that physical activity will replace traditional medicine for certain ailments. So the Centers for Disease Control and Prevention urging doctors to have their patients try exercise before turning to powerful drugs. The new recommendations are part of an effort to stop the overuse of painkillers and other drugs. We've heard about that problem. For more on this, let's bring in Dr. Campbell. He's a practicing cardiologist and author of Women and Cardiovascular Disease, Addressing Disparity in Care. Thank you so much for joining us.
Thanks for having me. So
this particular effort to prescribe exercise over medication, are there certain ailments that we're talking about?
You know, it was amazing. If we have high blood pressure or diabetes, or if we're overweight, a little bit of exercise goes a really long way. You can lower your cholesterol in many cases just by exercising regularly.
And how does exercise contribute to your overall health?
You know, almost every system in the body is able to improve and do better when you exercise. Do you know obesity is a $150 billion disease, and if we exercise and eat right, we can prevent a lot of chronic disease.
Yeah, you prevent chronic disease and also live longer.
Exactly.
And in terms of regular physical activity, what specifically would you prescribe for people?
You know, the most important thing is to get out there and move. The CDC recommends that we exercise about 150 minutes a week. So if you can get out and walk for 10 minutes a day, you've already got it. And then progress. Move to weight training and interval training. Just something to get you off the couch and burn some calories.
And so should you just jump straight into it immediately, or should you maybe slowly progress?
Great point. I think one of the first things you want to do is meet with your doctor. Get an understanding of what your health status is. Is it safe for you to exercise? And help let your doctor help you choose what type of exercise to do.
And when we talk about prescription drug abuse or overuse or overly prescribing medication, how big is that problem in the United States?
Do you realize that 70% of all Americans take at least one prescription drug? That's over $350 billion. And I think we're a quick fix society, and that really, you know, speaks to the fact that maybe exercise before pills can go a long way.
And how does that impact the cost of health care, either to an individual or to a hospital, a provider?
Well, you know, the cost of exercise is almost nothing. You know, it's free to walk outside, it's free to choose a better diet, but when you talk about these prescription drugs, almost $350 billion are spent when these 70% of Americans are on drugs. Do you know seniors over 65, a lot of them taking 10, 15 pills, so it's really hard to keep up and very expensive.
All right, so anyone, though, who is suffering from some sort of chronic disease, don't diagnose yourself. Make sure you go to a doctor first, because we're not saying that just exercise would help solve that.
That's exactly right. Exercise is a piece of the puzzle. It doesn't mean that if you exercise you won't need any drugs, but you may need less, and you may be able to actually reverse high blood pressure or reverse type 2 diabetes by exercising and losing a little weight.
Okay, Dr. Campbell joining us. Thank you. Doesn't sound bad to me.
Thanks.